Pertambahan kes kenaikan COVID-19 yang mencecah ke 4 angka baru-baru ini sememangnya sangat membimbangkan rakyat di Malaysia. Dikongsikan video frontliners di Hospital Sungai Buloh yang sedang bertugas merawat seorang pesakit COVID-19 oleh saudara Muhammad Hafiz Muhammad Nordin. Ekoran dari situasi ini, rakyat diminta untuk terus peka dan menjaga kesihatan diri dan ahli keluarga sebelum virus COVID-19 ini berterusan menyebarkan jangkitan. Doa dipanjatkan buat semua petugas Kementerian Kesihatan Malaysia, KKM dan semua pesakit diberikan kesembuhan semula.
Assalamualaikum warahmatullahi taala wabarakatuh. My name is Muhammad Hafizul bin Muhammad Yusof. My metric number 282345. Today, my friend and I will share our experience as COVID-19 patient. I'm going to share my experience as a COVID-19 patient stage 3 that has been admitted to ward. As all of us know, COVID-19 started since 2019 and the first case detected in Malaysia was in early 2020. Nowadays, COVID-19 is the most fearsome disease in Malaysia. Most people who fall sick with COVID-19 will experience mild to moderate symptoms and recover without special treatment. However, some will become seriously ill and require medical attention. The symptoms including fever, cough, runny nose, and shortness of breath. Being a COVID-19 patient is the most painful experience that I face. The event happened in mid of 2020 when I was confirmed positive with COVID-19 and admitted to the ward. Initially, I got few symptoms which were fever, cough and sore throat. Then I sought medical treatment at the nearest hospital. At the emergency department, doctor has checked my general condition. Few blood tests, checked X-ray, and did tests for COVID-19. COVID-19 PCR show positive result, so I was confirmed to have COVID-19. At the moment, my oxygen level was only 93%. Thus, I need oxygen supplement, which is nasal prong. After few hours at the emergency department, I was then transferred to general ward. In ward, the doctor and nurse routine check the patient blood pressure and oxygen level. Besides, as early as 5 a.m., the doctor will take my blood for testing almost every day. It was hard because they will take a blood from my pulse to check my oxygen level in the body. Most of the patients require different level of oxygen supplement. For example, nasal prong, venti mask, and high flow mask. At the moment, I was only required the lowest oxygen supplement, which in nasal prong that gave me 3 liters per minute oxygen. After few days in ward, my condition getting better and my oxygen level has been normalized normally without the oxygen supplement. I was discharged from the ward and need to complete my quarantine days at home for few more days. Thank you.
Assalamualaikum, Miss. My name is Muhammad Zilmi bin Ismail. My metric number is 282283. I am going to share my experience as a COVID-19 patient stage 4. I was confirmed positive COVID-19 at the end of 2020 when the disease was increased spread in Malaysia. Initially, I was a close contact to a friend. I was isolating myself when I know I am a close contact to COVID-19 patient. When I was isolating myself at home, I developed shortness of breath. Thus, I sought my medical treatment to the nearest hospital. At the moment, my oxygen level was only 86%, so I need 20 masks for oxygen supplement. So, I was admitted to ward, and most of the patients in my ward require high oxygen supplement. In ward, I saw a lot of situations that taught me a lot about life. One night, a patient that has been placed beside me suddenly had shortness of breath, and his oxygen level keep dropping although he was on high oxygen supplement. He was attended by the doctor and nurse immediately, and he was intubated. Then he was transferred to intensive care unit. There was another patient that suddenly collapsed. CPR was performed by the doctor and medical staff about 1 hour. I guess. However, he was not able to survive. Being ward for almost 2 weeks gave me a lot of experience. As we know, the disease already become endemic and the trend for this disease start to decrease. However, there are still few patients need admission to ward and ICU. We have to take good care of ourselves and our loved. We must follow the advice and recommendation by the health minister. Although face mask is not compulsory, we are encouraged to wear it in the crowded place. Besides, we need to follow the prevention steps such as test, report, isolate, inform, and see, and practice routine hand wash. Last but not least, we are encouraged to take the vaccination COVID-19 virus. We hope our experience that we share will open our eyes and taught us a lot. Thank you, Miss.